Welcome to BioBalance Healthcast. I'm Dr. Kathy Maupin.
And I'm Brett Newcomb. And one of the things that Kathy and I have dedicated ourselves to throughout all the process of these podcasts and in the book that we're writing is to talk to people about making good health decisions and the process that's involved in making good health decisions. And one of the challenges facing people trying to make good health decisions has to do with the news media and the way that things are reported. When you have a 24-hour news cycle and people have time to fill, they go out and fill it. And so editors send reporters out and they get background stories that they put on file and they time and they save, and then they pull clips in when they need it to fill airtime. Such a situation has occurred recently on CNN Health, and there was an article on CNN Health headlined about a woman in California who was 56 years old and who died of liver cancer. But what made her newsworthy was that she had been receiving for about 6 months a new anti-aging medical treatment that involved injecting herself 6 times a week with human growth hormones, HGH hormones. And so her death is certainly very sad for her and her family, but the determination that her death was caused by this is a situation that occurs when people confuse correlation with causation. The reporters and the doctors that they interviewed do not say conclusively that this woman died as a result of this treatment, but they infer and imply that this treatment must have led to her death. And that's a scare tactic that we want to talk about today. So we're going to walk through that article, and we're going to talk about some of the points that the doctors who were quoted made in their argument, which is essentially a causation, correlation, confusion, and a scare tactic to promote their own particular perspective and agenda. And we happen to have a slightly different one, and we want to walk through what our differences are. And if you're interested, you can go to CNN Health and check the December 28th, 2011 website and find this article and read it for yourself and compare what we have to say with what they have to say.
I want to be clear about,
Yes.
We're not justifying the use of human growth hormone. I don't currently use that in my practice. That's not one of my fortes. And I don't really need it in my practice because testosterone increases growth hormone to a normal level. So in that way, I usually don't need growth hormone as an adjunctive therapy. So we're not talking about trying to justify a particular treatment, especially growth hormone. We're talking about the process of how mainstream medicine tries to attack new things, how it tries to keep us from doing new and very productive things that someday will be mainstream medicine. We're just at the front end of it. Every new medical treatment started somewhere, and this is starting with us.
An inference, an argument by inference is not an evidentiary-based argument. And so they're not citing evidence. They say things like, it is thought that HGH can lead to cancer.
There's no research.
It's also thought that
research.
The moon is made of blue cheese.
Yeah.
So do the investigation, do the research, and make your own decision is the point. So these articles are really, really very good because they raise questions that need to be answered both by medicine and by individuals. And so what we are doing today is just talking through what we read in the article, which you can check for yourself, and responding with the distinctions that we would like to make, because they paint with a very broad brush in terms of challenging some of the new treatments, some of the new methodologies, some of the new diagnostic issues, and they use terminologies like fad diagnosis, and they lump a lot of things together.
And snake oil salesman, and
yeah,
some other.
They use those kind.
Name calling's probably a bad thing. When you see that, you probably should investigate what they're name calling about. But having said that, I didn't even tell you about this, but long ago, you have to know how people are chosen to be interviewed. Long ago, I was called to talk to a national news agency about the use of Lupron. Mm-hmm. Lupron's a drug we use for endometriosis to shut down hormones so that endometriosis will go away. But they talked to me and they wanted me to tell them about all the complications I'd had with Lupron. Mm-hmm. Well, I didn't have complications with Lupron, partially because I knew how to use it, partially because it was necessary. I said, I have nothing to talk about. I haven't had complications. People get hot flashes and they're kind of miserable during the treatment, but they're better later. So That's it. And they said, well, we don't want to talk to you. So they didn't want to hear the good news.
If you don't have something outrageous to say or something challenging
negative,
to say. Yeah.
Something negative to say. So that's where they have to be calling lots of doctors to find these people who will have the statements that they have in this article. It's very distressing that these doctors are saying the things that they are based on nothing, on no knowledge of the subject.
Well, it's based on their passionate belief in what they do, and but the problem is, if you read the article, they cite references like to the Women's Health Initiative of 1992, which has been widely discredited, and yet continues to be reported in the news media as the standard of the argument.
As the truth. And it's not the truth. They found that they did the study wrong, and we've talked about this before. The study is totally false. Estrogen in oral form or non-oral form, if it's alone, and if it doesn't have a progestin with it, doesn't cause breast cancer. Well, and that's what they said. They said it did. So it doesn't. They found that was wrong. Right. So they're quoting this as if it does cause breast cancer. They didn't look at the newer studies.
And we don't want to be guilty of what is done in the article by painting with a broad brush. So when we say they are quoting, let's talk about who we're talking about. The primary physician that was quoted in this article is a man named Dr. Stephen R. Goldstein, MD. He's a professor of obstetrics and gynecology at New York University's School of Medicine. So he has outstanding credentials and a very responsible position. And we don't know the substance of his argument, but we disagree with his conclusions, and we disagree with the structure in which he makes his argument. For instance, he says things, and this is a quotation from the article, talking about the newer specialty that's becoming known as anti-aging medicine. He says the problem is that many of these so-called anti-aging doctors are making empty promises. They're one step above snake oil salesmen. Then he goes on to talk about what are the credentials of these doctors. They're not endocrinologists. They're not geriatric specialists. They're just doctors. So, Kathy, how would you respond to that as someone who practices anti-aging medicine?
Well, I'm an OBGYN like he is. So I have more knowledge about hormones than he does because I've specialized in taking care of people with hormones for 10 years, and he's doing general OBGYN. Okay, so I would say that my ability to make a judgment about if someone needs hormones or not based on good research is probably better than his. That doesn't mean he's wrong always. It just means that I have more experience. Anti-aging doctors actually have a board that they go to.
And that's another statement he makes.
He says they're not board certified. They are board certified. And there are anti-aging conferences every couple months. And once a year, all of us get together and talk about all the newest things that are out there and how to do them safely, because no one else is. We're the specialty that gathers in OBGYNs and endocrinologists and family doctors, internal medicine, ER doctors. We all are concerned about this problem, and we all want to take care of people effectively. So we get together and talk about all the newest research. And interestingly enough, most of the research that we pull from that's not in our own journals, which is there are anti-aging journals that we get, is from endocrinology. Now, I'm not an endocrinologist, but I read that journal every month, and all of the research there that is on women's hormones and men's hormones, which is what I do, is ignored by endocrinologists. They do diabetes and adrenal and pituitary. They don't take care of women and men's hormones. It's a lost science in between specialties. So anti-aging has filled in that gap. And so we've taken the information from both OBGYN and endocrinology and put it together. No, we're not just endocrinologists. No, we're not just OB, or I'd be delivering babies instead of taking care of hormones. And endocrinologists would be seeing diabetics. And there are not enough endocrinologists in the country. So it takes 60 to 120 days to even get in to see one. So it's a big shortage, but they don't have time to take care of these hormonal issues. And these hormonal issues really, I've taken care of my whole life with OB, and I did infertility for many years and had infertility for many years, so I had an interest in it. So I do get this.
Well, and the article is replete with references consistently to HGH. And then they talk about hormone cocktails and drugs that are created by compounding pharmacies that are not totally reliable, and that the doctors who create the original compound with the compounding pharmacist don't necessarily know what they're doing.
That may be true of some people in every specialty.
So yeah, let's talk about what you do and what you use or don't use in your practice, because this is a generic condemnation of anti-aging medicines and hormone
compounding pharmacies.
Treatments and compounding pharmacies. So respond a little bit with the specifics of what you do. For instance, you don't use HGH.
No, I don't use HGH.
Why not?
Because I use bioidentical testosterone in pellet form in both men and women, and testosterone in that form is like a time release. It increases growth hormone to a normal level. Normal levels are around 150 to 250. It doesn't take you up to 500 like maybe one of the shots would do. It's not higher than you would normally have when you were younger. It is just back to normal. So when I do this, testosterone is a very safe way of actually, by coincidence and cheaply, giving growth hormone. It just balances
Let me interrupt you. I want to quote from the article again for those that are interested. He says, the biggest weapon in the anti-aging doctor's arsenal is the willy-nilly prescribing of hormones. The concept is that if you take a 60-year-old woman and duplicate the hormone environment from when she was 20, she'll feel like she's 20, says Nanette Santoro, MD, director of the Division of Reproductive Endocrinology and Infertility at the Albert Einstein College of Medicine. It's essentially the idea of drinking the blood of young children. Again,
I'm horrified.
Again, the reference to
I'm
vampires
horrified that
who are feeding off of these poor women.
Here's what infertility doctors do. They don't do menopause. They don't do aging. They do infertility. They do young women who can't get pregnant. Yes, they have a knowledge of how our hormones work when we're young, but no, that doesn't mean they have a knowledge of how our hormones work when we're old. Plus, I suspect she's not very old. And I suspect she's never been in this position. And I didn't realize how important this was till I was in this position. I replace hormones, estrogen back to physiologic levels, just like when we were younger, when we were in our youth. I replace them back to that. Now, testosterone, because we lose our receptor sites, I replace at a higher level than is physiologic. But in women and in most men, it has no deleterious effects except maybe facial hair. So that's pretty minor.
Which
compared.
Can be, but if you have it, it's
well,
not.
you can get rid of it.
Yeah.
But you can get rid of it easily, but then you get to sleep and you don't feel like you're 20, but yeah, I feel like I'm 35.
Well, but the argument isn't, as I understand
I'm not drinking the blood of young women.
As I understand it, the argument of the anti-aging approach is not to say we can make you young again. It's to say that as you get older, you don't have to lose the quality of life. You don't have to lose the energy. You don't have to lose the freedom of movement. You don't have to just go sit in a rocking chair, Velcroed back to the wall while you drool your way to death.
Right. I'm not doing that. And none of my patients are going to do that. And these people are suggesting that we do nothing. Nothing for women after they're 45.
Their quotation is, do what your mother advised you. Exercise, have a good diet, and grow old graciously.
Well, that doesn't really work. When you're not sleeping and you have to go to work and we have extended adolescence, we're not even finished with our training till we're in our 30s. At least I wasn't.
It's hard to be gracious when you don't sleep and you're overweight.
Right. And you can't think. I mean, testosterone loss makes you not be able to think. And you can't heal from things. You get sick all the time. All of those things are treated by replacing testosterone and estradiol in women.
I thought testosterone made it difficult for men to think.
Oh, yeah, well.
But
that's a whole different kind of thinking.
Okay.
But no, it helps men to think, but it helps them to think cerebrally, not below.
I see.
Yeah.
Think with the big head.
Yeah. Right. It is your primary hormone, and it's actually our primary hormone. Here's a piece of information you'll love. We have 3 times as much testosterone in our bodies when we're young than we do when we are old, than the estradiol level. So our estradiol level is 1/3 the level of our testosterone. Yet medicine and all its knowledge has told us that estradiol is our primary hormone. If you have 3 times as much testosterone, why is testosterone not our primary hormone? And why do the men get it and we don't? Because the FDA approves it for giving it to men, but not to us. That's the other inequity in this article, and I think we're going to have to go on to another podcast because we've got so much stuff. But the other inequity is they don't even address the fact that the FDA approves and medicine approves the use of testosterone for men not to get old, for them to keep their sexual prowess, for them to keep their muscles, for them to keep their mind. It's all in the endocrine journals. You just have to read it, the Journal of Endocrine and Metabolism. And they approve that for men. Now, if it's our primary hormone in terms of dose or levels, then why do they not approve it for us? Are they keeping the secret for them? And they may be, because by golly, we're always competing.
Well, the conclusion is that it's a complex and complicated process, and you want to be careful when you look at this issue to look at the evidence and not just the claims. You want to make the distinction between the arguments by causation and the arguments by correlation, and you want to find the data. So this is a really good article to have out there because it stimulates, or hopefully it will stimulate, investigation and curiosity and the pursuit of evidence in search of making good medical decisions for you and for your family. And it's a conversation that we're very passionate about, and we will continue in the next podcast. If you have questions or responses or feedback, whatever, you can get in touch with us directly
by calling my office at 314-993-0963. That's BioBalance Health. Or you can go to our website at biobalancehealth.com. You can send us an email at podcast@biobalancehealth.com.
Or you can reach me at my blog, brettnewcomb.com.